Hi, I'm Dr. Jeff Borenstein. I'm the editor of Psychiatric News, and I'm here with Dr. Jay Scully, the CEO and medical director of the APA. Jay, thank you for joining us
It's
today.
great to see you, Jeff.
This is an exciting meeting here in San Francisco today and this week. How are you finding it?
Yes, I think people are very excited to be here. Of course, it's San Francisco and it's a wonderful city, but the program is really extraordinary. This year we have 3 Nobel laureates who will be lecturing, and of course this item of the diagnostic manual, the 5th edition, has been where it's inaugurated here at this meeting. So right now it looks like we will actually have more attendees, professional registrants, than the last time we were here, which was the start of the economic crisis in the country. So it appears we're going to do very well. Everybody's very excited, and it's a wonderful program.
It truly is, and there's a lot in the program related to DSM-5. I want to ask you, you've been in the leadership position to bring it to fruition. What are your feelings about it finally coming to life?
Well, it's a great relief, and everybody's very happy. It's great to see it. It really is an improvement on where we were, but that was 20 years ago pretty much, and it's good we needed it, and it's going to help clinicians, and the end result, of course, is to help patients do better. So I think we've done that. Now it's time for people to see for themselves what all the fuss is about. When people read it, they'll see that many of the critics were talking about some other book, not the one we published. It's very usable, user-friendly. There's 3 sections. The first section is how to use the book. The second is the guts of it, the criteria and the various disorders. And the third are it used to be the appendix, but it's the categories of potential disorders that need more science, that aren't quite ready, and some of the scales and so forth that can help people make assessments. For those who've been involved with the DSM and using it for many years, we've done away with the 5 axes. There's just 1 axis now, and I think people will be pleased with that. Our research in the field has shown among clinicians they like it, and so do patients. They see it as more user-friendly and able to be understood. We know it's not a do-it-yourself diagnostic manual, but people are interested in it, and we recognize that there are social interests and cultural aspects of this that go beyond the usual medical textbook. It's incredibly wide selling that we understand. I think Saturday it was number 8 on the Amazon list of top 100 books, which is just unheard of for a medical book. So it speaks to the interest in the population at large and in what we're doing.
There's tremendous interest in DSM from professionals to the lay public, and certainly the DSM-5 serves as a guidebook based on cutting-edge clinical information and research to help us help patients even better. That's
correct, and it's a remarkable process that has been going on for 6 years intensely with hundreds of experts, clinicians, psychiatrists, psychologists, social workers, nurses, pediatricians, neurologists, etc., from 39 countries around the world. 92 different universities sent people to help us, including the institutes, our National Institutes of Mental Health, Addictions, and Alcohol. And so it's really got the best science that we have at the moment. We hope there'll be breakthroughs in biomarkers, as we call them, the underlying biology and pathophysiology, as it's called, of these disorders. We haven't gotten those yet, so we're eager to see them come along. But in the meantime, as the New York Times editorial board said, this is the best we have. And so we're very proud of the work that was done and people who put so many hours into making this the best possible guide for clinicians.
Well, your leadership at APA has been an important part in making that happen, and along those lines, you've announced your planned retirement from APA, and I want to ask you about that.
Well, that's true. I'm planning to retire this fall. We have a great new medical director who will be coming on board, Saul Levin, who's a distinguished and experienced leader in organizational medicine. So I think he's going to do great, and I'm ready to go on to whatever's going to happen next. It will be much less intense than the last decade has been for me.
Well, on behalf of the APA, of psychiatrists in general, and more importantly, our patients, I want to thank you for your years of service to APA, to our profession, and I know that you're going to continue to be of service even after you've retired from this position. So thank you very much.
Thank you very much, Jeff. It's been great to see you.